Well, good morning to you. It is Tuesday, October the 13th, and it is 7:46 in the morning. I just got into the office and wanted to get this recording out of the way so you had the next lecture. This will be 4A. The first part of chapter 4 was 4. So this is chapter 4A. I am beginning on page 69 of my PowerPoint, and we're starting with the slide at the bottom, and it says chapter 4, facilitate language continued. So I have my coffee, I have my phone on mute, and I'm going to turn down the ringer. Well, the ringer's already down, so we won't be disturbed. And uh, it's live TV, so to speak. So there could be somebody come to my door. My GA may walk in. I don't know. But it is live, so anything can happen. I hope you're doing well. It's a nice, well, overcast right now, crisp fall morning, and we had rain, and my lawn needed it, so life is good. So we are going to continue and talk about language and the importance of parents talking to their children and what that will do for them. We talked a little bit about quantity and quality of language and the input that we're giving children. And I have parents sometimes say to me when they come in for therapy, well, you know, once a week just isn't enough. He needs to be seen 3 times a week. He's really delayed and he really needs the help. Can't we get into therapy more? And sometimes it is legitimate. And sometimes we do need to increase the number of visits in a week. However, quantity doesn't equal quality. And by that I mean you can have the child come in 3 times a week. But if the quality of your treatment or the quality of your progress isn't measurable and observable, you may not really get the benefit of the additional time in therapy. So the quality of what you provide is equally as important. But I will agree, quantity sometimes isn't enough. I hear this in parents coming in, and they're just not happy with the amount of time that the child's getting services in the public school. Well, those caseloads can be very, very large. And sometimes the therapist just doesn't have the time to provide more therapy. And it isn't always the public schools' sole responsibility to remediate or to provide additional help. It is also the family's responsibility to sometimes seek out some services. All right, let's talk about attention. Joint attention was mentioned in the last lecture, I do believe, on page 68. We talked about joint attention. And joint attention, of course, is when both the caregiver and the infant toddler are both focused on the same situation, the same object, and conversation can take place. The parent or caregiver may make a reference to something, the child's attention is drawn in that direction, and then some additional language stimulation can be provided. So joint attention is an extremely important part of learning, not just for the infant or the toddler, but joint attention even within a classroom. If the teacher is making reference to something on the board and the child is not attending, you don't have joint attention. And attention, the ability to attend, is vital in terms of learning. So if I have a child that has behaviors that are permitting that child to attend, I'm going to have to get the behavior under control so the child can focus. And that's a different lecture. But you've got to be able to attend. You know, sometimes you go to class and you've been up all night studying for a big exam, but you're committed to going to class, as you should go to class. I appreciate that. And you're just exhausted. Maybe you're hungry. Maybe you just can't get comfortable in your chair. Well, little ones are like that too. But it's very difficult with those outside factors that are competing with your attention for you to stay focused. So in order to bring a child back to attending, sometimes I whisper, oh, okay. And when I changed my volume, you probably leaned in, you checked your volume, you might have been involved in something else and you were listening to me, but when I started to whisper, you immediately came back. So sometimes changing your volume, repeating what they say, if they have much language. When I'm engaging a child in a therapy session and I have a book, and the child maybe is sitting next to me or is on my lap, I've got this book in front of me and I am pointing to pictures. I'm not asking them maybe to do anything. They're just there. I might say, oh my gosh, look at that big dog. Wow. And I might turn a page. Oh, look at the baby. Look at that baby. Oh, that baby's yawning. I might point. So I'm not reading every word on the page. What I'm doing is simply exposing the child to the literacy. I'm making a reference to something on the page. I'm getting excited. I'm using some enthusiasm in my voice. I'm turning pages. I'm not staying on one page very long. I'm just turning the pages. And I might just point to something, and then I might turn the page again. Another teaching strategy that I like to use is if I have a child in therapy who's just a little squirrel and they don't want to sit with me, come and look at the book with me. No. What I'm going to do is I'm going to pick up that book. The child is sitting across the room, and I've got that book in my hand, and the child can't see the pictures because remember, they don't want any part of that book. So I'm going, oh my gosh, wow, what is that? I don't know. And then I turn the page. And then I might say, oh, I really like that. I think that would be good to eat. Then I might wait, and I might just kind of peruse the page a little bit. Then I might turn it and I might go, oh no, what happened? Pretty soon, here comes that little child. And they want to know what you're looking at that's so interesting. And then I just have them, I just wait and see what they're going to do. I might have them sit down next to me. And I might say, turn the page. I'm not going to say, can you turn the page? Because I might get a no. There is no option. I'm going to say, turn the page, to give them a direct request. The Hart and Risley published findings from a study, and they wanted to assess how the interaction took place between a parent and a child. And they looked at 42 families over a 3-year period. The children were 7 months to 36 months. And the interactions were recorded once a month for about an hour late in the afternoon. And there were three key findings from that research. What they found was the amount of parent talk relates to the variation in the child's IQ and language. Let me read that again. The amount of talk that a parent provides can make a difference in the child's IQ and language abilities. Just simply conversing. You don't have to have a fancy toy. You don't have to have electronics. Just talking to the child. Oh, look, we're driving down the road and look at that beautiful red tree. Oh my gosh, look how tall it is. And we keep on going. Oh golly, I see a big truck over there. Wow, it's really loud. And you're just simply talking. The amount of talk directed to children from birth to age 3 does predict academic success by the ages of 9 and 10. There is research that supports the amount of talking and the advancement in IQ and academic success. Children who are advanced in their language have parents who talk to them a lot. Talking, letting them hear the language, hearing the rhythm in your voice, the cadence, the rising inflection, and maybe you're going to whisper again. Oh my gosh, I see a mommy and a baby, and the baby's asleep. Shh. So those were the three key findings from the Hart and Risley study. Some families spoke 3,000 words an hour. Some only spoke 500 words an hour. And this rate of vocabulary growth for the child is directly related to some of the words used by the parents. Now, there was another study with the Lena Foundation, and it's the Language Environment Analysis. And Gilkerson and Richards reported on a natural language study, and they had this little processor thing. I believe that the child wore, the parent wore, and so they had recordings and they could truly assess what was being said. Not that you just had to remember it or you were trying to frantically write it down, but they could go back and listen to the recordings. So this processor captured a full day of conversation, and they could analyze the words that the child heard from the adults and the vocalizations that the child produced. They analyzed 12 hours per day taken each month across 6 months. They had 329 children as opposed to Hart and Risley, 42 families. I was going to say 49, 42 families. And these children were between the ages of 2 and 48 months of age with their parents. Now, if you want to look at page 135 in your textbook, you're going to see the results of the Lena Foundation study. Here it is. Let me come a little closer. Page 135, key findings from the Lena Foundation study. And just a few key points. Children who scored consistently between the 90th and the 99th percentile on independent standard language assessments spoke substantially more to those children. The parents did. And parents estimated that they talked more to their children than they actually did. And I find that to be very true. When a parent comes in for a diagnostic and I'm talking with them, I might say, well, how many words do you think he has? And the parent just looks at me in horror and sometimes in embarrassment because I don't know. I've I've never written it down. I don't know how many words. Well, they shouldn't be embarrassed because why would you be writing them down? Uh, Parents are busy, families are busy, lots of things going on if you have two or three children in your home. And so you may truly not know. So then what I'll do is I'll question them. I might say, well, do you think he has 10? Or do you think he has 25? Or I might say, does the child say dada, mama, dog, cookie, night night, nana? So I'll give them a list of words that I know children are going to begin to use early. It could be the dog's name, it could be a favorite toy. But regardless, I'm going to throw out some possibilities. And then I'll begin to document that and count that so I can help the parent with that decision. We do know that children need to have an expressive vocabulary of at least 50 words before they start to string them together. You can't string words together to make a phrase or a sentence if you don't have the words in your vocabulary. So that makes sense. You have to have enough in the basket, so to speak, to be able to generate what you want or to produce it or to give it out. Hopefully that makes sense to you. Most of the language training comes to the mother, and mothers account for 75% of the total talk in the child's environment. They talk 9% more to daughters than their sons, and they talk more to the firstborn, particularly firstborn male. Most of the talk occurs in the late afternoon and early evening as opposed to other times during the day because that's when parents are home. They get home late afternoon, it's a crazy time. Uh, you're getting clothes changed and with other older children, maybe there's a snack involved. You're thinking about what you're going to prepare for dinner. So lots of activity going on. So most of it happens when parents are home. We don't have as many mothers who are working at home as opposed to out of the home. And families have to have a two-check income. It's imperative these days just to make ends meet. Children of talkative parents were also talkative. The more television in a child's day, the lower his or her language ability scores tended to be. Got to watch the amount of time that the child is watching TV. And that Risley study was from 2008. Well, okay, 12 years ago. So now what is the competition? It's not just TV, it's the electronics. And the electronics are usually, well, many times they're games, and it may not be something that is really language based in terms of something that's fun to do but teaching you something. So it's not just TV anymore. But we do know that parents sometimes will put their children in front of the TV to watch a cartoon or watch something while they can prepare dinner. Hey, I did it. My daughter's 38, but I did it. You know, that's how you get things done, so to speak. We also found out that parents of children with autism tended to talk less the more severe the child's symptoms were. And I would see that in some of the parents that I've worked with. We teach them to stimulate language, talk to your child, interact with your child. But if the child is not giving you something back, you think it's just not working. I'm spending all this time and I feel like I'm doing all the work. So the more severe, the less the talking took place. Uh, and it varies from day to day. We know that. Some days are busier than other days. I do think that we have to consider how active our lives are, and maybe you don't have to enroll your children in as many activities. Maybe if you have a child who is typically developing, it may not make a difference. But if you have a child that has a delay, you need to think about, how am I going to work in therapies, soccer practice, dance lessons, piano lessons, and it's fun to do those things. I remember it well, but you have to consider how you can make it all work. Actually, I was talking to my daughter the other day, and we were talking about my grandson, and he plays hockey. He's in Ohio, and I asked, well, how many games do you have this week, or this weekend, or how many practices? And she said, we've cut them back. We're not going to be as busy as we were, even though he loves it, he flourishes, but she said, we just can't do it. Plus, she's homeschooling now. So you have to think about what's going on in your life. And sometimes you will have to say to a parent, it's okay not to enroll them in karate. It's okay not to uh, start dance lessons this year. Um, it's okay to hold off. Maybe you can have a play date and you can be outside with your child and their friend and you're playing soccer, something like that. I know that we want to do those things, but especially if you have a child that has a language delay, you might want to think about that. I want to show you, this is page 71, and this is where I was talking about the Lena Foundation, but I want to show you, I am not using this slide. It's, let me get the page number in there. It's the bottom of 71. I have marked it out. I mentioned quality of talking, and that is important. Um, and I don't want to say that parents need to watch their language and the words they use, but they need to watch their language and the words they use, because a young child will pick up profanity quickly. And one of the reasons that they do is because we react negatively to that. They got a reaction from us. They know that it's something they're not supposed to say, and they'll use that again to get that reaction from us. Or we laugh and reinforce it. So we really do need to consider what comes out of our mouths, and we need to consider what they see on TV, for sure. A recent study by SOSA out of 2016 reported that traditional toys and books were associated with higher word counts than electronic toys. And I think probably it's due to the interaction of that toy. Also, with books, a young child can't read that book yet. So somebody has to be with them. A child sitting down and doing this activity solo, well, where's the interaction in that? It's important to have that interaction between two people, that conversation between two people. The child doesn't know how to direct the activity. The parent knows how to direct the activity. When the child is watching TV, and you may be sitting there with them, but there's not much talking going on. It has a tendency to be more quiet. And you may find that with your friends sometimes, that come over to watch a movie, and when you're engrossed in that movie, you don't talk a lot. So you want to have an activity in which you can engage the child in some kind of conversation. 1-year-olds spend an average of 80 minutes a day in front of the TV. 2-year-olds spend about 2 hours. Um, it's not wrong to put them in the high chair in the playpen, or put them down on the floor in front of the TV while you prepare dinner. But watch the time and the number of times you do that, maybe in a week. Mere exposure to language is not sufficient for teaching the new words. Teaching. There has to be some engagement in teaching them those new words. At the bottom, the second PowerPoint slide here is perception and comprehension, and there's that perception, that word perception again. We know that 1 to 6 per 1,000 babies are born with a hearing loss. And we now do newborn hearing screenings, which we can catch a lot of those hearing losses much earlier, provide intervention, amplification if they need it, and language development has a better chance of following a typical path. But there are times when they can pass that newborn screening and then the hearing is lost. They pass the screening, they go home, and then for some reason the hearing is gone. I had that happen with a family where the child, I think the first newborn hearing screening was suspicious, but they got some fairly typical results the second time, but then within 6-8 months, the hearing was gone. So we do want to keep an eye on that so that we can intervene early intervention regardless. If it's language delay, autism, CP, whatever, you want to provide that intervention early. Receiving and perceiving speech from others is critical in learning words. In auditory patterns, we expect the child to attend specifically to the speech sounds, one, discriminate the difference between speech sounds. Discriminate between speech sounds means ba, da, k, g, being able to fine tune the discrimination to know it's boy and not toy. We've changed the initial consonant, but you've got to be able to hear it, and discriminate it. You have to detect and generalize patterns in the speech of others. There are times when I'm listening to people talk, and I've got a bit of a hearing loss now. It comes with aging. And there are times I think somebody says this, and it wasn't that at all. It was something else. So I know that I've got some high frequency loss, and if I'm not careful, I will misinterpret what's being said. The child also has to store and remember the sequence of sounds in words, discriminate between words, not just the sound, but discriminate between the whole word. Compare words to a model that's stored in their memory, where they're putting those new words in that schema, in that file in their brain, and make discriminations among intonational patterns. When we have a rising inflection, it's a question. How'd you do that? You can detect that it's a question by the intonation of what's being said. And these are essential components in the process of language development. And according to my PowerPoint, there are 7 points that I make in that. Infants, we know that one of the first sensory systems that come into play for infants is the vision. And infants can also make gross discriminations among sounds. That fetus can hear. And that's why you'll see daddy's talking to mommy's belly and things like that. And they can generalize or localize sound. If somebody's standing behind them and they can't see them, and they're off to the right or left and they ring a bell, the child will turn. Can they tell the direction that that sound is coming from? And they are far more interested not only in the faces of humans, as we've talked about, but also voices. Within our language, we know that there are certain combinations of vowels and consonants, and that is called phonotactic rules. Phonotactic rules. That's probably a good question for the test. For example, you would fully expect to have O SO be together, that consonant and that vowel. You would expect a for cat to be together. That's reasonable. We see that in many different words. So we learn the consonant vowel combinations. Consonant, 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 STR, strap. We know that those three consonants can go together. You would not expect to see or hear B, B, R, Z, B, B, Z. Not in standard American English. That is not the combinations that go together. Now, it could be in another language. Quite honestly, I do not know. But phonotactic rules tell us typically what our consonant vowel combinations are like. And this will govern our English syllables for sure. Each syllable is allowed only one vowel sound and consonant sound combination, and you never exceed 3 in a row. That 3 consonants, st, you would never exceed 3 consonants in a row. And those are phonotactic rules that, did anybody teach you phonotactic rules? No. We just simply have learned them as we have matured and developed. And of course, learning them from reading, writing, listening, using all of our sensory systems. Fast mapping. Well, how can we teach vocabulary to a child who could be language delayed? Well, one of the techniques or strategies that we use in speech therapy is we work in categories. Children can learn categories and items that go together that are categories, groups that furniture, fruit, clothing items. That's a way to teach and get some vocabulary into them very quickly. And that is called fast mapping. It's a process by which children hear and understand words. Before the age of 3, a toddler has a vocabulary of more than, what do you think? What do you think? Before the age of 3, the toddler has a vocabulary of more than, well, if you said 500, you're correct. 500 words. And he accrues these words without direct teaching. Remember very early on in the semester, we talked about the parrot and we talked about Coco, the monkey who was taught sign language. I certainly hope I included that into a lecture. And this individual researcher had this monkey, and this monkey was with this researcher 24/7, over 20 years maybe. And this monkey learned, let's say, 2,000 signs. Well, the one-on-one, first of all, was going to facilitate more learning and the amount of time, 24/7. Think about that. Nobody worked with you one-on-one 24/7 for you to learn what you know today, and therein lies the difference. To comprehend the meaning of a word, the child must have the auditory cue. They've got to be able to hear it. This is what activates the memory, the information that you have in the schema about the sounds and symbols, that phonological component that we've talked about, and you move from that phonological level to the semantic level. You move from the phonological act. Oh, to cat. And when you're moving from that phonological level to the meaning, then the word is comprehended. Therein lies comprehension. And these 3 points you will find in the first slide at the top of the page on page 74. Page 74. Now, fast mapping is associated with a very large or a larger vocabulary spurt that a child experiences around 2. So fast mapping just contributes to that explosion when they're able to begin to put those 2 words together. And remember, 50 words helps you have enough words in your vocabulary to be able to string them together. Let me repeat that. Fast mapping has been associated with the large vocabulary spurt children experience around 2 years of age. And we know that that's the crucial window for language development and for intervention. That's why we have First Steps, which is that 0 to 3 population that we work with. Not all words are easily fast mapped. If you're not using the word very frequently, if you have a book and you're looking at a story and then all of a sudden the story introduces a dinosaur and they have very long names, Tyrannosaurus Rex. Well, if you only hear that once in this story, that's not going to be a word that you're going to probably remember and fast map. How often the child hears the word and the similarity between words will impact that vocabulary learning. And they learn words that are in categories much quicker. Much quicker. Now, slow mapping, on the other hand, is when you take some of those words and you tweak them a little bit. It's how you expand and fine-tune word meanings. And that's part of that pre-linguistic vocalization that we talk about. Sometimes the words that they're hearing pre-linguistically before they are able to use those words and their repetitions. We know little ones love books, and we know that they have favorites. And every night you read the same book. And if you change the words, they're going to call you on it. And you think, I can't read it one more time. But that is how they're learning that pre-linguistically. We know vocalizations from babies occur in a predictable sequence. And we know that in the very beginning, it's all just reflexive. They're just crying. But when they're able to produce some sounds, then we get into a completely different set of vocabulary for what we are doing and what we're trying to facilitate. Now, I think I'm going to stop there because then we're going to get into, we'll review a little of this. We're going to get into more information on cooing, babbling, and jargon. And so I think this is probably a good place to stop. Okay, have a good day. I hope life is going well and you're navigating all this COVID-19 stuff, and I hope your family's healthy and life is going along as it should. Okay, remember, you can always email me with any questions that you have. When we finish chapter 4, I will be doing a review for the second exam, and I will be giving you at least 2 opportunities to attend an overview in preparation like I did for the first exam. But don't hesitate to contact me if you have questions, concerns. I'm always available. Hope everything is well your way. Bye.